Breast cancer is the second leading cause of death among American women. It will occur in 1 out of 8 women. So if you look around you in a group of small women, there is bound to be at least one woman that you know who may be affected by breast cancer. And we have a lovely guest here today that I am excited to be able to talk to and get to meet personally today. But I think my sister T, Dr. Franklin, Tanya Franklin, she should be the one who introduced this special guest today.
Well, I feel so fortunate to have this wonderful lady here. Caitlyn, she is a boss in every sense of the way. She is an entrepreneur. Her and her business partner opened up a bar, and it's in a male-dominated field, whiskey, bourbon. And these two badass ladies came in and busted it up. They own Trouble Bar in Louisville, Kentucky, and it is one of my favorite spots. You can see I got some gear here. But Esquire magazine named them one of the best whiskey bars in the country. That's a huge deal.
That is amazing.
And we are so lucky to have you here. One thing that many people may not know about Caitlyn, not only is she a boss and she is courageous in her career, and she is a breast cancer survivor. So we're going to spend some time talking about her story, trying to let everyone know about screening, and she's not the typical patient. So this is such an important story. So thank you and welcome.
I'm too close to the emotional edge to hear nice things about myself from Dr. Franklin.
Now, can you describe the day that you were diagnosed, when you got that news?
I can. So I had no reason to think that the lump I felt was cancer. And I am a highly anxious person. And to overcome that anxiety, I try to approach things really practically. So I had seen doctors. We had come up with different treatment plans. We finally decided we needed to go through a diagnostician to confirm exactly what was happening. I can tell you how much I didn't think anything was wrong by the fact that my husband was out of town. Mm-hmm. So I had a biopsy. I went home. I had an allergic reaction to the tape. So all I was thinking about was like the fact that my skin felt like it was on fire. And the next day I got a call from the doctor. I really appreciated them getting back to me so quickly. And the doctor just said, this is cancer. And I was alone in my house because my husband was traveling. So I called him, and I think it was a testament to the fact that we still are. We're relatively young, but we were very young. We were newly married. And he was on a work trip, and it was really important. And he said, yeah, okay. And I said, yeah, I'm going to be fine. I'm fine. I'm calling my friends, and I'm going to have lots of support, and you'll be back tomorrow. And we got off the phone. He called me back. He said, I'm coming home now. I was like, yeah, you are. You're coming home right now. This is like, we're going to blow up our lives now.
Yeah.
And that's how it was. It was, everything's fine. But because I'm an anxious person, I was prepared for things to go wrong. And then things went wrong.
How old were you when you were diagnosed? Because you look so young now. Look at you. You're beautiful.
Yes.
Moisturize and don't be racist.
Yes.
I love it.
It's good advice for all of us. I was 34 when I was diagnosed. I'd been married just over a year.
So I can only imagine being at that age. And like you just said, you just were married and starting a life with your husband. What was your biggest fear at that time once you got that diagnosis?
Dying.
Yeah.
That's it. I've known a lot of people who had breast cancer, and most of them have survived it. But it struck me very, very forcefully in that moment how much I wanted more time with my husband. So that's it. Things seem really, really important until they narrow down to the size of whether or not you're just going to be alive to do any of them. And then nothing seems very important except just trying to have more time.
Gives you a different perspective.
Sure does.
And so, but things can change over time.
Mm-hmm.
So how did your fears change over time as you were seeing you were doing okay and like things are looking good? Because you have new fears, I'm sure now.
Yeah. There were points where I got to have what I think are like more normal fears. And everyone I've spoken to who's gone through cancer treatment has gone through some of these same fears. So what impact will the treatment have?
Yes.
Will I be able to have children after if we want them, because we were not parents at the time? what's going to happen to my body? Will I ever feel normal again? Will I be tired for the rest of my life? And then when I was on chemo and I was very sick, will I always feel this way? What will the long-term repercussions be? I was on a chemo called adriamycin, which is known as AC and colloquially referred to as the red devil. It looks like poisonous Kool-Aid going into your veins. It's disturbing to see. And nurses wear what looks like nuclear protective gear so that what they are putting inside your body will not touch their skin. That's how toxic it is. There's a lifetime limit on how much of it you can have. And it can cause osteoporosis. And that runs in my family anyway. So I was like, I'm going to be like 50 and my bones are going to be crumbling. And it can cause heart failure, which I think is still the leading cause of death in women, right? So then I was like, all right, so, you know, those fears felt normal in a way that was reassuring because those were fears that said, I will be here long enough to have these concerns. And then honestly, you know, you'd get that perspective back. Like things would be going well enough for me to worry about things like how will I look and how will I feel and what will our future hold? And then something would go wrong again. And I'd remember none of that was important compared to the fact that I just wanted to be there. Yeah. Trying not to die.
You mentioned like the family members that you have had that's been impacted by this disease. Did you have a significant family history or were there any other risk factors that you had that made you a little bit more aware of looking out for certain lumps in your breasts?
Sorry, I need to. I think this might be perimenopause. Someone said perimenopause, you can get itchy ears.
I'm there with you, sister.
Just falling apart in real time on camera. So I have a family history of breast cancer. But with that being said, my mother is one of 7 girls. 2 of her sisters have had breast cancer. So there actually is no way of knowing if breast cancer runs in my family or if just an average number of women get breast cancer. And then I have a first cousin. My aunt was her mother, and I have a first cousin who passed away of breast cancer. And as far as other risk factors, that is typically the biggest predictor. So I was aware that it was something that could happen. And none of really the other ones. I don't have any of the genetic markers for it, even after, you know, we went through all the testing, because if you can find a genetic marker, you can be like a little more aware for your family member's sake. My family members could have gone and gotten tested for it. You can do, what's it called when you do the treatment preemptively?
Prophylaxis, chemoprophylaxis.
Yeah, you can do prophylaxis. You can like maybe get the surgery early and kind of like save yourself some trouble and some anxiety. So as far as the other risk factors, not so much, but just knowing that it was like present in the people around me made me aware.
Do you feel like during that time, like when you went to your doctor's visits, your annual visits, do you feel like your doctors, especially with that family history, paid attention or listened to you when you felt like you were concerned? Because you said you have a little bit more anxiety.
I do, yeah. And doctors don't respond well to anxiety. I will be honest with both of you.
I'm not offended.
No, doctors don't respond well to anxiety, and that is something I'm aware of. I think like all of us are aware of how, as women, and then I'm sure both of you have had the experience, like it's also different for Black women, how doctors will respond to you based on, for poor women, that's also very different. So what I have going for me is that my mother is a nurse and she taught me to medically advocate for myself.
Yes.
Yeah.
So when I was in college, I found a lump, and that lump would become a problem that would persist up through this diagnosis. So I found a lump when I was in college during a self-exam, and I ended up making an appointment. I did freak out. I lost my mind, but I ended up making an appointment and going to see a doctor, and we did an ultrasound. So I would say for younger women, we often have dense breast tissue, and mine was crazy dense. So I couldn't have a mammogram. And also the lump sat really, really high up on my chest. It wouldn't have fit in a mammogram. So I went in, I had an ultrasound on it, and everything was fine. And then it went away. So it was kind of like a misbehaving milk duct, basically. And it came and went through my 20s and my 30s. And it is that same lump that did end up being cancer in my 30s. It was
Really?
Wow.
It was like one rogue milk duct was really like out to get me.
So it's just active. It was hyperactive.
It was hanging out. It was doing its thing. It was not up to me. So that was really helpful in the sense that I did sort of stay constantly aware that this could be an issue. And it was less helpful in the sense that when it came back, I had no reason to think it was cancer. Mm-hmm. But because there's a family history, because I'm an anxious person, because I'm an organized person, I treated it like it probably wasn't a problem, which helped mentally and emotionally, but like it could be a problem eventually. And that saved my life because I ended up with a really, really aggressive cancer.
And I will say that many times as doctors, we pay attention to first degree relatives.
We do. And that's what was really important. That
Yes.
You said. Yes.
She doesn't really have the risk factor that we've been trained to really pay attention to. But I always think when you have a patient that has extensive family history, I perk up. I do perk up. And when people are anxious, the response is not to blow them off. It is to reassure people. And you reassure patients in a lot of different ways. And if at the time testing, evaluation is needed, you have to do those things.
Yeah. I was going to add to that because when you said I had testing when I was younger, sometimes that can equate to us as physicians or as providers. Well, it was evaluated. You were good. You don't meet the certain age. It's less suspected. You had no other risk factors. You had second degree relatives, not a first degree relative like a sister or your mother. So it could have delayed diagnosis even more if you didn't have an advocate. And then you also have someone in your family who has your back to say, no, these are the things you need to demand in a doctor's office. And unfortunately, not all of us and our viewers have that type of support to kind of push us to seek that care. And so that's why your story to me will resonate with so many people, and not to cause more anxiety amongst, women, but also to use this as an example of why we advocate and ask for further imaging like ultrasounds or biopsies.
Let me be your advocate.
Yes.
I started self-exams young because of my family history. And I'm really glad that I did that. So I knew when something changed. Because my mom taught me to advocate for myself, I got very comfortable with it. I'm also, and this is the number one thing I tell people, I will change a doctor. If I don't think a doctor will respond to me,
ma'am.
I love
I
it.
just
Ma'am.
change doctors. And people feel so much pressure about that. I beg people. What I like to think of is, for some doctors, I am not a good patient. I'm doing them a favor. And it helps as a woman to think, not that I'm inconveniencing someone or being rude, but that I'm doing them a favor. I'm doing you a favor. I am a very specific patient to the degree where my doctor, so when you get a cancer diagnosis, you get a team. Mm-hmm. It's one of the ways in which I'm like, hey, when American healthcare works, it is the best in the world. It's just that everyone should just have a team of doctors who talks to each other and not just cancer patients. So my doctors triggered a cascading domino effect. Each doctor chose another doctor they wanted to work with, which is how I got the right team. Mm-hmm. I don't think they'd like it if I said they warned each other about me. But for example, my diagnostician called my surgeon and said, this patient does not want a meeting where you don't have any new information. It was crazy to me that anyone would want that, but it makes sense in retrospect that a lot of patients don't have the information that I have. Mm-hmm. They don't have a background in research. They don't have a master's degree where they had to learn research and how to navigate the internet. So it was not helpful for me to go in and have a doctor be like, I don't know anything new. I'm just here to reassure you, because I know you can't reassure me. My mother was a hospice nurse. Like, I'm fully aware of what the cycle of life looks like. And the reason I tell people to advocate for themselves is that I've seen the fear of diagnosis prevent people from getting the care they needed. And all I can reassure people of is cancer is not the scariest thing. And that's something my mom said all the time. She would say the worst thing they can tell you isn't that you're sick, is that there's nothing they can do. And the earlier you catch it, not only are you more likely for there to be something they can do, but also, and again, like, I think this is very helpful for women, you can alleviate treatment. So if mine had been caught any earlier, I might have needed less treatment. I was really lucky. I very narrowly avoided radiation. But I mean, we're talking like inches, degrees.
Yes.
So even with that advocacy, part of it is overcompensating, which lots of us do socially. So I overcompensate for my anxiety by trying to stay very calm, by working it out with doctors, by indicating to doctors that like, I'm here, I'm on your team. The priority isn't managing my anxiety. The priority is managing like if something is or isn't wrong with me. So, and that approach was fine because this lump had come and gone before. So I told the doctor, excuse me, I saw the nurse practitioner at Planned Parenthood. Shout out to Planned Parenthood.
Yes.
They will always take you
They
when
will.
you don't have health insurance.
Always.
I love
They
Planned
will.
Parenthood.
They
As soon
will.
as I had any money, I started giving them my money because they had treated me, you know,
For years.
for years.
Like me
I
too.
Same.
love Planned
Yes.
Parenthood. I'm so appreciative of Planned Parenthood. So I went to the nurse practitioner. I told her what was going on. I told her I'm newly married and I had been off birth control for almost a decade at that point. And I said, let's see if it's hormonal. Do you mind if we try birth control? She said, sounds great. A few months later, it had not gotten better and it had started to hurt. Now that's another indicator that it's not cancer. Cancer doesn't hurt. So I was like, all right, at this point, whatever it is, I want rid of it. Every now and then I would just get this like twinging pain and it really hurt. And I thought, man, I just hate this thing at this point. And we went in because I was like, she said, you know, if you want to get it removed, we have to see a diagnostician and go through this process. And it's only because we did that we found out that it was cancer. But mine was unusual in many ways. It was breast cancer, but it was very high up. It was above the breast. It hurt because it was pressing onto the muscle as it was growing. Very aggressive, but not as advanced as it could have been, which was pure luck. Just like a lot of things that were not indicative, and took all of my doctors by very unpleasant surprise when they found out it was cancer.
Yeah.
And to think about it, it wasn't even in the breast. Technically, it was up on the
all way up
chest,
here, yeah.
right? Okay.
Really, like in this flat part. Yeah.
Yeah. One of the things that you said that I think will resonate with, especially us and as with Black women, the not wanting to know.
Yeah.
And that can lead to delayed diagnosis. And the fact that you stayed on top of it, knowing your history. And I feel like I hear that a lot with even some of my family members or friends that were diagnosed later, where they knew something was off, but they just wanted to avoid it. And with knowing that it is so common among women, as we stated earlier, and having that awareness early on, and it can lead to less invasive treatment.
Yeah. If you have it, you just want to catch it as early as possible. So I think it's with everything, I think it's just a mindset shift.
Yeah.
So if you're thinking, I don't want to know that I have it, I'd beg you instead to shift your mindset to, if I have it, what I want is to know as early as possible. I want to alleviate treatment as much as possible. I want to make this as easy as possible. I know women who were diagnosed because of mammograms at stage 0.
Yeah.
You know what
Yes.
the treatment is at stage 0?
Nothing. You just monitor.
It's a relative. I mean, it's not nice. You wouldn't be happy you were going through it.
Right.
But I mean, it's a walk in the park comparatively. And that's what I want for everyone. I'm like, catch it as early as possible. If something bad's going to happen, just, you know, it's, your husband was talking about plumbing earlier,
Yes.
right? You know,
Yes.
you see the drip, you can tighten it up and now no more drip, or you can let the drip go. And it turns out it was actually a problem with the plumbing, and now your whole house is out and you got to go stay in a hotel. We're trying to prevent the cascading effect of just not addressing the problem.
Yeah, and breast cancer is something that's been studied and researched. There's so much energy that's been put behind it that it is one of those cancers. When checked and caught early, you can have a very long life.
Yeah.
Yes.
Live forever.
Yeah, you know what is so funny that you say that?
What?
My surgeon was very convinced that my cancer had spread. This was a preoccupation of hers. And we did all this testing. And I had one. So when breast cancer spreads, it spreads not always. Man, the most haunting thing anyone ever said to me, my surgeon looked at me. I said, well, breast cancer spreads through the lymph nodes. She looked at me. She said, cancer can do whatever it wants. I was like, ooh.
But you respond to that.
Cold.
You're the kind of patient that can respond to
Yeah,
that
I was
well.
like, okay. So, but it does typically travel through the lymph nodes, and we test the lymph nodes with breast cancer patients to see if it has spread, how far it has spread. And I had one lymph node that looked weird on imaging. And so she was like, look, it doesn't look so hot. And by the time she was done with me, I was so annoyed. I said, listen, lady, if this has never been in my lymph nodes, you have to say I'm going to live forever. So I go, I get the surgery done. She calls, she says, so I had a full pathological response, meaning I had a complete response to the chemo, no trace of cancer left.
Beautiful.
In the breast.
Congrats.
Great. We love to see it.
Love it.
We do.
Pathological complete response. Yeah, I read my notes.
That's why you got to be careful nowadays. People can read the notes. You better be nice in your notes.
I see where you said patient confesses to anxiety. Patients have cancer.
Right.
Patient will confess to being a little anxious about this twinge she feels.
About this big diagnosis I just got. Yes.
So, I had a pathological complete response, and I said, what about the lymph node? She said, lymph node shows that you never had any cancer there. And I was so high. I was on so many drugs. I guess I screamed into the phone, now say I'm going to live forever.
Oh my God. Love this.
She's that kind of patient. This is why I love her.
You picked the right doctor, though.
Yes.
I'm like, listen, if your doctor isn't like, I really enjoy you as a patient, do them a favor.
And find someone else.
That's
Find a
right.
doctor who will tolerate you. I'm a weird patient. You gotta find the right doctor.
And listen, I'm an educator. So when I tell residents, like, your patient may not tell you that you suck, you did not give me the information in an appropriate way that was compassionate, they will just leave and you will never see them again. Mm-hmm. So it's important to know that people are going to make their decisions, and they should make their decision that's best for them.
You spoke on this a little bit already about how you developed your own care team after this diagnosis. Mm-hmm. And the first one was that point of contact, the doctor that you chose. Mm-hmm. And then that doctor was like, hey, Caitlyn coming, and you're going to have your ducks in a row messing with her because she's going to ask you questions. Yeah. And I think that you should demand that from your healthcare team when your life is yours. Looking to them to help guide you on this very big journey and their expertise. So is there certain things that your doctors did throughout this process in ways that they supported you and your family as you navigated treatment and even surveillance?
Mm-hmm. Yeah, my doctors were amazing. So I started with my diagnostician, and that triggered everything because when I called, I was assigned to a random doctor, which is pretty normal. Hey, here's the first open appointment.
Yes.
Nothing on men. Thanks to Dr. Tanya Franklin, I also have a wonderful male OBGYN, something I never thought I would say, who I adore. Wonderful man. But typically, I ask for a female doctor. I'm more comfortable. So I was assigned to the only male doctor at the practice. And I said, I'm so sorry, if you don't mind, I would prefer a woman if possible. So it's one of the better decisions I ever made on the fly because, of course, I'm tired and I think I should get in as quickly as possible. I'm so glad that I did that because it just happened to lead me to the most perfect doctor for me. Young, straightforward, kind, compassionate, but very clear. No nonsense. No beating around the bush. And this is very important in cancer care. No aw face. Goes like this. Aw. I have seen oncology nurses make the aw face. Okay?
I didn't know this was a thing.
The aw face.
That is very good advice.
Yeah. There's, you know what? It's just who you are as a person. Some people have the aw face inside of them and some people don't. So I ended up with a doctor that just doesn't have that face. And she said, if this is a problem, what hospital system do you want to be part of? And I said, where do you think I won't get sepsis? And she said, I just sent my grandfather to Baptist East. I said, great. And she said, there's a young surgeon there. She's new, but I think you'll like her. And that's how I got my surgeon. And my surgeon wanted to work with my oncologist. My oncologist is famous, Dr. Gita Joseph. Love to Dr. Joe. Wonderful person. I found out when I was going under anesthesia for my port surgery that my anesthesiologist sent his wife to Dr. Joe. Yeah. So I've got the oncologist that doctors send their wives to, right?
Yes.
Right.
You like your wife? You're good. You're married? You like her? Okay.
Not your wife.
And so what they did was they supported me based on who I am as a person with like the full acknowledgement that I'm a whole person and we all handle this fear and this stress and this anxiety differently. I wanted as much information as possible, and I wanted to participate in my care, which I think a lot of patients don't know is an option. So please let me tell you, you do get to participate in your own care, and you do get to make decisions about your care. And it's incredibly important, I think, in cancer care, especially because there are options in cancer care. Yes. So your doctors will have a recommendation in a way they prefer to do things. Sometimes their preference doesn't actually statistically change the outcome. So my doctor liked to do neoadjuvant chemo. So chemo first.
Yes.
I liked that. I thought that was a good idea. I was like, oh, then we'll see if the chemo's working. That's really helpful. So we did neoadjuvant, and I understood why we were doing what we were doing. And I could explain it to my father, who would get like 3 words of medical advice in and then be like, I'll call you back. And then he'd call my mother and ask for it in English. And then he'd hang up on her too. Very stressful to have a daughter with cancer. Sorry, Dad. But also my surgeon really, as I mentioned before, my surgeon really thought I should have radiation. And I had looked at it and I said, if it's never been in my lymph nodes, then statistically radiation makes no difference.
Yeah.
It won't improve outcomes. And I have, when I say incredibly sensitive skin, I mean, I got a 3rd degree burn from the surgical tape.
Yeah.
My surgeon came in so upset at me after my first surgery. She said, you're really allergic to adhesive. I said, yeah, I told you that. She goes, you didn't tell me that correctly. You didn't tell me enough. Like, she would call my doctors, my other surgeons that I had. And she was like, this is how allergic she is. And I thought, if my skin responds that way to tape, I can't imagine what radiation would do.
Oh, it would have been very traumatic for your skin.
And if I just listened to my doctors, and then I also decided I didn't want implants because I'm young and I have all these like weird reactions to certain things. And I thought, God, they're going to have to be replaced. I'll have to have more surgeries. So instead, I chose a surgery that uses your body's own tissue. I knew about it because it used to be the only surgery they did. And it's the surgery my aunt had done like 40 years prior.
Wow.
And it's really specialized. So, just like having all this information, participating in my own care. And then my dear friend had the same cancer that I had at the same time. And telling her, you have the option, discuss it. I had met her doctors and I felt very strongly they would love for her to participate in her own care and to want things and to say like, hey, is this possible? Can I have this? And whenever she did do that, whenever she was like, this is something I care about and it's important to me, and she advocated for herself, I could see the relief on her doctors' faces because they just wanted to give her what was best when like there were so many ways her care could transform that wouldn't have a statistically significant outcome difference. So it was like, if you can have column A or column, do you want one of those?
Right.
So yeah, I will always advocate for get on top of your care as early as possible. It's your body, it's your life. I want you to be comfortable with it. I want my friends and family to be comfortable with it, and then get to know your doctor. I mean, I'm getting old. I have so many doctors now.
Right.
Until I got diagnosed with cancer, I had never broken a bone. I'd never spent the night in a hospital, and I'd never had a surgery. So I just really knocked them all out.
Yeah, you did it.
What you're describing sounds like the tumor boards that we go to. So we have this thing in medicine when someone has a cancer, then we create a tumor board where we get to look at the newest research and the newest treatment options. And at my institution I trained at, we would have patients who we will ask if they wanted to be a part of that conversation. And it seems like you were very like, I want to be a part of the conversation so I know what my options are in the care I received. And it seems like we have different types of patients. Some patients just want to know, what would you tell your mom? What would you tell your sister? They don't want to make those decisions because it seems like a lot because they don't want to make the wrong decision. But I like that you're reminding women, like, if that is something you want and your doctor is not giving it to you, find a different doctor because that is out there.
Sometimes I did say, what would you do? Actually, there was only one surgeon in Louisville at the time who did the reconstructive surgery I wanted. And this was probably the biggest and most important decision I made by accident. But I interviewed with the doctor. I really, really liked him. But I had a feeling I probably needed a doctor with a little more experience. And I talked to my doctors and they don't want to say like, go to it. I kind of like went through this. And one of my doctors, I was like, would you go to this doctor? And they kind of like shook their head a little bit. I was like, okay. My reconstructive surgery ended up being horrifically unnecessarily complicated. I went to a surgeon who had done this over 100 times. He was European, and the whole hospital was like Grey's Anatomy. Everyone was really, really good looking. So good looking. They were all crazy good looking. They were all in plastic surgery, crazy good looking. And I was just surrounded by like very attractive people going under being like, I'm going to have like weird soap opera dreams. And I opened up my eyes the next day. What was supposed to be an 8 to 10 hour surgery, which was already incredibly long, had become a 14-hour surgery.
Sure.
And this man looks at me, he goes, you were my Friday chip shot. here's what went wrong. I basically had like a vein in a place of vein, like, because all of our bodies are different. Like veins are
variations.
Like, yeah. So I had one of those variations, and I don't think anyone with less than 300 of these surgeries under their belt could have done what this doctor did. And I was very, very lucky. So at all points, I've always been great. Like I've asked doctors, hey, I don't have a strong opinion, even loosely held. What would you do? I've said, what would you have your wife do? What would you do if it was you? But it's all part of like getting the information to live my life. And I know that there are women listening right now who would do more than that to buy the right car.
That is true.
That is a good point.
Yes.
And part of the reason is they're thinking, well, my car will have my family in and these other people that I love. And this is what I will tell you. If you don't think your family can purchase a car without you, then you need to take care of yourself so that you can be there to make the lunches and do the scheduling. It's so hard for us to take care of ourselves just because we value ourselves. But if you value your kid's mom, and I also tell people that, you know, when people are like going through different medical things, it's really, really hard. There were days that Kaitlyn Soligan Owens, MA, there were days I did not get in that chemo chair, but my husband's wife did. It's like, man, I cannot do this for me today. I don't want anything badly enough to do chemo today. But I did not want my husband to be a widower at 40 if I could prevent it. And so far, so good.
Yeah. And there are some situations where I think it's very valuable when a patient asks, what would you do? Yes. Or what would you do for your mom? Because I do treat my patients like they are my family. Like, I want the best for you. I always want the best for you. I will always do what's right for you. And so I used to shy away from that question. And now I don't, because I'm like, I'm going to take care of you like you are my family member. And this is what I would do because I think you'll have the best outcome. So thank you for saying that it is normal for people to ask that. Some people are uncomfortable asking it, and some people are uncomfortable answering it.
I do think being a doctor is like maybe the hardest thing to do. I really do. I watched my oncologist is older and practical and very funny and straightforward and difficult. And she recently did I'm going to tell on you, Dr. Joe. She recently did an event with a friend of mine. And I told my friend, I'm not going to say no to her. Wouldn't even know how. And I can already tell you, you're not going to be able to say no to her. So she's just going to get whatever she wants. But she's still a person. And I could see what happened when she cared about, I could see how much she cared about me. And I thought, she's cared about patients every bit as much as she cares about me and not been able to give them what she wanted to be able to give them. What an awful thing to have to go through. And I understand why doctors draw back and need some emotional distance. Mm-hmm. My doctor was in her 20s when she's open about this. I don't think she'll mind. My doctor was in her 20s and pregnant when her husband had cancer. She's been through it all. She's seen everything. Mm-hmm. And I don't know how she is still emotionally accessible and present and kind and compassionate. And she is all of those things.
Yeah.
I don't blame any doctor for needing some emotional distance from a job that can obviously really, really wreck you.
Yeah.
But at the same time, as a patient, I'm telling you, advocate for a connection where your doctor sees you as a person.
Yeah.
And if your doctor, for whatever reason that has nothing to do with you, isn't capable of giving you that emotional availability, someone else will, because it is the difference between you feeling comfortable saying, I don't want this treatment if this treatment's an option. I think I should see another doctor with more experience. I think I need this. I think I need that. Or even being able to like having the comfort to say, how would you treat your mom? And your doctor being able to answer you honestly. Mm-hmm. These things will make an enormous difference in your life and your quality of life. And if you can't do it for yourself, it will make a big difference in your husband's quality of life, your partner's quality of life, your wife's quality of life, your children's quality of life. If you are receiving the best care, they will be in a much better position.
Okay. Well, I think that we've heard about how you were able to maneuver like your relationships and your interactions with your
medical
doctors.
Industrial complex.
Yes. Which is a whole nother thing. And you really have to have some intelligence to maneuver the healthcare system, really, how hard it is. And sometimes when I think of my own family, if I were not a doctor,
yes,
what would happen to them? So it's very complex. What were some of the challenges you experienced within the healthcare system or the healthcare insurance system outside of the actual physicians and providers that you built that good relationship with?
I ran into two major problems. One is that over the years of trying to communicate effectively, I can come across maybe a little understated. So this became a problem in my communication with my doctor who, cared about me and liked me and thought well of me and wanted to do right by me. So for example, I was saying, man, I am really, really sick. I'm so sick. I'm crazy sick. And of course that makes sense, right? I'm on chemo. And then I'd have to call in on the weekend and call the nurses line because I was so sick. And the nurses were telling me, hey, like even for chemo, the degree of how sick you are feeling is probably not right. And we should take a look at it. So I went over this with, my doctor all the time, like, hey, I'm feeling this, but if you tell me it's normal, I believe you, it's normal. And I only once brought my mother in. My mother lives in Massachusetts and she came out to visit and she was going to take me to chemo. Only my husband and one friend took me to chemo. I thought you got to have like really the right person to go through this with you. It's bad to look at you while you're on chemo. It can be really upsetting.
Okay.
And I didn't want to put people through that. My husband was the right person. He's got the right mindset. We had an entire system. It starts with Dunkin' Donuts and we maintain that system for all doctor's appointments to this day. You've actually never seen me in your office without a very large Dunkies iced coffee. And my mom had come in and my mom was going to take me to chemo. And that was the day that I told my doctor, look, I'm feeling really, really sick, really this sick. And she said, don't worry about it. It's not a problem. And then I was in the chair to get chemo and she came in and she was like, you know what she said to me? She said, have you been drinking? I was like, are you out of your mind? Have I been drinking? Do you know how bad I feel? Have I been drinking? My kidneys were failing.
Wow.
And she said the problem was, because I was like, I've done it again. I've understated to the point where someone is like not hearing me. And she said, you should be yellow. She was like, you're literally for these numbers, you should not be walking and talking with clear eyeballs. Like that was a problem was I was constantly trying to be like, I want you to know how bad it is. And I also don't want you to think I'm overreacting because I found that people don't communicate with me effectively if they feel like I'm overreacting because I'm a woman. Mm-hmm. And the other problem was insurance. To the degree where I had a bad reaction to a chemo and every time you have to change anything, you have to go to the insurance company and ask. And the insurance company didn't approve my chemo. So now you've got a cancer patient with very aggressive cancer on a very aggressive chemo schedule who's going to go home without chemo. When am I going to get chemo? My father called me. He said, put it on a credit card. Like, it doesn't matter what it costs. Right. Like, this is your life.
True.
I was like, first of all, you don't know what this costs without insurance. There is no credit card with that high a limit on it. But yeah, it was navigating that interpersonally. Even doing my best, I still ran into those problems, and insurance was awful. I made calling an insurance company a part-time job. I had to call the insurance company because while I was under anesthesia, they sent my pathology out of network and they wouldn't cover it. So it was going to be like $7,500. And I just so happened to know that the Affordable Care Act, Obamacare, said that if you couldn't consent to something out of network, then you couldn't be charged for it.
That's amazing.
But there were so many times I just wouldn't pay a bill because I could see that it was going to get corrected. I was like, that bill's too high. Insurance is going to step in. And then bills would come and I wouldn't know what was what. And I would be dating everything and writing who I had spoken to and when it had happened. And I mean, even for an organ, it was awful. It was so debilitating that it got to the point where I would see a medical bill and like not be able to open it. It was so intimidating. There was just so much of it. And I was so exhausted. I've cried talking to insurance people. It's brutal to navigate. I don't recommend it for anyone.
It's so distressing hearing this.
It is.
Just as a physician, we see you, we connect with you, we offer these treatment recommendations, and we put an order in a computer and we walk away. And it's not that we forget about you. We hope that the things that we've talked about are able to get done. And to know that you've had this major diagnosis in your life and you're still having to fight all these other things alongside it, to me, it's just like, it's as a physician in this society, to know that that's what my patients deal with. And I hear it on other levels too. We deal with women who are diagnosed with all types of cancers and even pre-cancers of the cervix or even pregnancy. We have to fight against these things. And just to hear you speak of it, and you're standing with a smile on your face today, but I can only imagine when you were in the thick of it, right? So,
I mean, I can bring it closer to home for you. So, Dr. Franklin is my doctor because I've had multiple consecutive pregnancy losses since my cancer diagnosis. And I have been actively miscarrying, losing a child, and staring at a bill for the last pregnancy loss, calling the insurance company being like, I thought this part was covered. I thought that part was covered. It's brutal. And I always go back. You know what a boomerang errand is? Mm-mm. It's when you drop off an errand and it creates a new errand. It boomerangs back, right? So you go, you're like,
I have lots of those.
I do.
You're so proud of yourself. You're like, oh, I dropped that thing off at the dry cleaners, and then the dry cleaners calls and they're like, it's missing a button. So now you gotta go all the way back and get it from the dry cleaners. Now it's clean, but you can't take it home. You got to take it to somebody to fix it, right? That's one of the problems I've seen with my friends and family going through any treatment for anything is it creates boomerang errands. So you go, you get the treatment, you think, cool, I'm done. Then you get a bill. Then you have to make a call. Call this person. I already called that person. Call this number. That's a dead number. Now I got to call back, but I don't get the same person I spoke to before. The American healthcare system is 100% set up, designed for us to fail to utilize it.
Yes.
Because if you can't use it, then they don't have to pay any money for anything.
And you're a woman with health literacy, right?
Thank you for saying that.
You know,
You get better at it with
Very
practice.
strong.
yes. And most people who
It's
receive
so
a
hard.
diagnosis like this may not have the ability to advocate in that way for themselves and to be and even know the questions to ask or know that they can call an insurance company to demand these things. Understand that there was something under the Obamacare Act that could get a bill off of their, back so that they don't have to worry about it. While you're going through this, because I feel like this is one of the most distressing things is as someone who loves you, as you're going through a diagnosis like this, we always want to know what are the right things to say? How can I support you? And sometimes we don't find the right words. Sometimes we don't know what those acts are. What would you say to people who have supported you that you think was those acts that you're like, these are things you can do for people who receive a diagnosis of cancer or any other terminal illness that you feel like was the most touching for you during those times?
This is going to be one of those other ways in which I am not exceptional in like a positive way. I'm just an exception. I am the oldest daughter. I'm so accustomed to organizing that when I got diagnosed, I immediately thought of how everyone would respond emotionally and then gave them assignments to support me.
Yes.
Their preferred
I love it.
assignments. So, my mom is really great at organizing and online ordering since I taught her how to use the Amazon cart correctly. And my best friend is highly organized. And my mom actually did this for her. My mom had everyone send things that I might need to my best friend. And then my best friend organized everything for me and brought it over. People wanted to cook. I really appreciated that. Honestly, if someone you love gets diagnosed with anything, I would ask people who've been through something like that what they most needed, and I'll just go ahead and rattle it off for you. Honestly, the best thing you can get people is gift cards. So you never know what you're going to
So
want to
smart.
eat. So
Yeah.
cooking feels so thoughtful and kind, but you have such awful food aversions and you just feel so sick most of the time. Gift cards were the absolute best thing because then I could have something that sounded good to me and not worry about the money because you're so stressed about money. I couldn't read. I was on steroids and absolutely out of my mind, or I was sleepy and I couldn't concentrate. I had really bad brain fog. So I was constantly watching TV or movies. So my cousin, thank you, Jacqueline, got me a gift certificate to Apple, and then I could just download whatever I wanted. And again, not worry about spending the money. I told people, and I find this to be true for most patients who are stuck at home and sick, package day, man. A package at the door was like the best feeling.
Oh, that is such a nice gift.
One of my cousins, thank you, Tara, put pictures of her kids on like a mug for me. So I had like cheerful little kid pictures on a mug. My friend Erin, thank you, Erin. And thank you, Ransom. Ransom did this as well. They made me soft blankets.
Yes.
And they were like pictures. One of the blankets is pictures of my friend's children. Very cheerful and nice. I still use it. And one of the blankets is pictures of my husband and my dog. Still use that too. Just really, you know, there isn't a lot you can do. And having been on the other side of it, like as a source of support for my friends who've now gone through their diagnoses for different things, including cancer, there's so little you can do and you feel really helpless. And so what I would tell you is everything you do matters. Every single kindness people feel. You think like, oh, it's too little, it's not enough. It is. It's enough. Someone was thinking of you. Someone did you even the slightest kindness. Someone cared about you. And I will say very directly, please don't visit. You're so tired. Mm-hmm. Actually, you've both been pregnant. You're so tired and you love this person and they took the time out of their day and they've done so much for you and you want to be present with them, but you can't give the right social cues. Like you felt fatigue. Yeah. There's no fatigue like pregnancy fatigue, except chemo fatigue.
Right.
You're so tired.
Well, and when someone comes over, you have to entertain them. So there's that pressure socially to entertain someone.
It is nice to ask like, hey, do you ever want to get out of the house? Do you want me to take you for a drive? I would meet up with people for coffee when I was well enough. So being treated like a normal person, like, hey, do you want to go out and grab coffee? When I was able to do that, it was great. And I could just say like, hey, I have to go.
Well, this is another question. There are some people that just freeze and they kind of back off. They may not call you because they don't know what to say. Yep. What about what are the right things to say to someone?
I think I always just say, I'm so sorry this is happening to you. You know, just like honesty. I think that in order to help the people we love through difficult things that we haven't been through personally, we have to get very comfortable feeling sad and helpless. And that's why people freeze and back away.
Yeah.
And I'll speak to both sides. If you are going through a diagnosis and people in your life are not responding the way that you wish they would, I'm so sorry. And I would only say that you don't have to carry all of them forward with you. It's okay to let some relationships go. But I'd also encourage you with, it might not be forever. There are people who didn't understand what I was going through, but years later went through something really difficult on their own. And they always feel terrible and they apologize. Everybody gets wherever you are eventually. Everybody experiences suffering that makes them compassionate and supportive. So don't think it's forever, but it's okay if it is. But there will be people around you that are the right sources of support and you deserve that. And it's okay to think this is the person who's there now, who gets it, who understands, who can be this for me. And it's okay to lean on that. And then as someone who wants to do the right thing, it really is just being there and showing up and saying, I will be here for you however you want or need me to be. Yeah. And it does help to be proactive. Sometimes it's hard to like think of things or, you know, it's nice when someone says like, hey, I sent a gift card. Hey, I did this. Hey, I did that. And there is, I swear you can Google it. How do I support my friend with cancer? Like cancer patients write about this stuff. Yes. It's the same as someone going through anything else. Mm-hmm. You know, people go through pregnancy. You go, oh, what do I do for my friend who's having a baby? What do I do for my friend who has a cold? For my friend who just bought a house? We do communicate better now and more widely. So these things are available. This may be the research background, but if you're feeling helpless, Google is free. It's totally fine. You don't have to know. And I'm also like so sorry for everyone on both. I'm so sorry anyone has to go through these things. But there are really good structures for it, and you will find the right one. If you care about someone and love them, you are going to find the right way to support them. You are doing a good job. You're doing your best.
And you know who we don't want to forget? Ben.
I would never forget Ben.
Ben is wonderful.
He's my favorite person.
He's a great partner.
Incredible.
He's there with you. You all were married for a year.
Yeah.
Before your diagnosis. Yeah. And so a lot of things were changing for him. He probably had his own fears.
Oh, yeah.
And how did he have to support you? How did it change your relationship? How did he have to jump in and even change his role in your relationship?
Yeah. My husband went from having a young, healthy wife to having a completely debilitated emotionally, mentally, and physically partner. Everything changed overnight. He went from my husband to my husband and my caretaker. We'd we try to split like the running of our lives, which includes the house, the car, we try to split the running of our lives equitably and fairly. It will shift at different points. He works outside the house more now, and I'm in the house more. I'm doing more of the house. There have been times where it's, been one or the other. Everything shifted to him immediately. I couldn't cook. I couldn't do the dishes. I couldn't stand for very long. I was so nauseous on chemo. I really could not move a lot of the time. So he did that. Immediately stepped into that role. So suddenly he becomes completely responsible for a life built for two people to support it.
Right.
For a dog that's supposed to have two people who can take it on walks while working full time because we needed his health insurance and his job. That's why we still have a house. It was an awful thing to have to go through. The thing that really helped was that I asked him to please have support that was just for him and not for me. So while I really appreciated how much his family stepped in and wanted to support me, I had a lot of support, and I wanted Ben to have people who were specifically his.
That's beautiful.
And they did I'm so grateful. I'm grateful to his brother and his mom and his aunts and his cousins. And they all wanted to be there for me, and I appreciated that. But the thing they did that saved my life was being there for my husband, who deserved that.
That's so beautiful.
Yes.
Also, marry well.
The best advice one of my mentors told me is that your success as a woman is going to be based on the partner you choose. And that is so true.